Hello everyone, my name is Dr. Harim Jafar Hamar Rashid. I'm periodontist and I am a lecturer at University of Sulaimani. I dedicate these lectures to the students of the College of Dentistry at University of Sulaimani. I want to start a series of lecture about the periodontal science or periodontology. And my first lecture starts with the topic of healthy periodontium. As we know that the diagnostic skills required to identify the periodontal disease, particularly in the early stage, it's based on the sound knowledge of clinical appearance of the healthy tissue. So in order to understand the disease, you should know the healthy one. So let us talk about the clinical features. First of all, we are talking about the gingiva. The gingiva mainly comprises many segments or many parts. One of them is free gingiva or gingival margin, and the other is attached gingiva. And here we have oral mucosa. And we have two grooves. One of them is mucogingival groove here, and the other one is the free gingival groove that separate the free gingiva from the attached gingiva, and the mucogingival groove separating the oral mucosa from the attached gingiva, the oral mucosa from the attached gingiva. As we know that the healthy gingiva is pink in color, there is no redness and there is no swelling. And we should have the interdental papilla pyramidal in shape and filling in the space between the teeth. We have the free gingival margin or the marginal gingiva, which is the most coronal part of the gingiva and demarcated by a groove, as we said, from the attached gingiva. And its depth varies between 0.5 to 3 millimeter in depth. And this wall, the free gingiva, comprises the wall of the sulcus, of the gingival sulcus. Then we have the attached gingiva. The attached gingiva is keratinized, and actually it's firmly bounded to the underlying bone and the cementum. And the width of the attached gingiva varies among the locations inside the mouth. For example, it takes the narrowest width at the lower lingual aspect of the mandibular incisors and labially, in the canine region and the first premolar. So the width of the attached gingiva may vary between different locations inside the mouth. And if there is no inflammation, it may increase during the aging process. So this width will increase during aging process if there is no inflammation. And sometimes we may face indistinction between the oral mucosa and the attached gingiva. So in this case, we use a solution named Schiller iodine solution, in which stain the keratinized gingiva as orange and the oral mucosa as purple blue. This can be used clinically to detect the demarcation between the the attached gingiva and the oral mucosa. And here we can see the dissections of the tooth and gingiva schematically, showing the different part of the healthy gingiva. Here the tooth surface. Let me bring the pointer. So here's the tooth surface. This is the enamel. And this part, which is the wall of the sulcus, named free gingiva. And here, clinically, as I talked about, here we can see the groove clinically on the gingiva, separating the attached gingiva from the free gingival margin. So it is free, it is not attached with any periodontal ligaments, and it's the wall of the sulcus. And here we have the attached gingiva. Most of the collagen fibers are located here, so it's tightly bonded to the underlying cementum and the root surface or the tooth surface. And here we have the junctional epithelium. We may talk about this in separate lectures. And this is here a periodontal ligament connecting the alveolar bone with the cementum. And here we have oral mucosa, which is non-keratinized and clinically separated from the attached gingiva through the mucogingival line. Radiographically looking at the healthy periodontium, we may find here, for example, the crest of the alveolar bone. It should be well defined. It should be away from the cemento-enamel junction by 0.5 to 1.5. And we may see at the radiograph mostly the periodontal space, periodontal ligament space, which comprise the area of the periodontal ligament. Especially with the paralleling technique, we may see it perfectly. And there is no sign of any lesions, any radiolucency, and extra bone loss. As we know that the periodontium is comprised from gingiva, alveolar bone, cementum, and periodontal ligament. So in the radiograph, we may see the hard part of the periodontium, which are cementum barely, and the periodontal ligament as a space, which is indicative sometimes for the disease, for the presence of disease in case of widening of periodontal ligament or excessive occlusal forces, and the alveolar bone. So in case of healthy periodontium, we have intact crest of alveolar bone, intact periodontal ligament space, and there's no any obvious features of radiolucencies.